So you're just in time to join us for Straight Talk, where you get nothing but straight talk from our expert panelist and our host, Dr. Straight. And here he is.
Hi, I'm Dr. Tim Straight. I'm the Chief Medical Officer at Brooke Army Medical Center. Welcome to Straight Talk. We thought doing Straight Talk would be a fun way to answer these most frequently asked questions that we get and get you the information that you really need to know.
All right, we're ready for our questions, and our first question from our first patient is...
Dr. Straight, can you give me an idea when the flu shots will be available for military families?
Sure, great question. Assuming we get our supply on time, we anticipate having the vaccine available about the third week of September, basically from the September 22nd for 3 months to make sure everyone has a chance to get the flu vaccine. We want everyone to come in and get that, everyone 6 months and older. So if you can hear me and understand what I'm saying, you need to come in and get the flu vaccine. There may be some patients who need it earlier, and so if we do get an earlier vaccine, if you have a chronic medical condition or some disease that maybe makes you a higher risk, we'll want to have you come in and get that a little sooner. So that may be available a couple weeks before everybody else.
And now we're ready for our second question. Question number 2.
So Dr. Straight, aside from the annual flu shot, what other vaccines are recommended for children and adults?
Good question. So the CDC actually puts out a vaccine schedule. That schedule is for children as well as adults. And so in kids, they start out at birth. As soon as you're born, you get hepatitis B, and then we have a vaccine schedule that's followed 2, 4, 6 months, and then every well baby visit afterwards, as well as once the children start to go to school, as elementary school, for example, and then again in middle school. Also for adults, we get boosters every 10 years. Tetanus, that tetanus booster includes a whooping cough, also known as pertussis. That's very important. And then if you have a chronic medical condition, you may need something extra. And so the pneumococcal vaccine is a good example of those who have chronic medical conditions. You may need to get that vaccine to further protect you. I also want to point out we have a travel clinic at BAMC, so if you're planning on some international travel, having a nice fancy vacation, or somewhere even for TDY, please come in and see us in the travel clinic that's located in the infectious diseases clinic. They can go over exactly where you're traveling to, what you plan on doing while you're there, which is important, and figuring out what vaccines or even medications you might need to make your trip a success.
And now we're on a roll. How about question number 3?
Dr. Straight, if my child plans to play sports, when should I schedule my child's back-to-school sports physical?
Well, what are you doing right now? I would say get on your phone and call for an appointment. It's that time of year, everyone's trying to get their kids in to get their school physicals and sports physicals done. We have plenty of appointments right now, but as we get closer to school starting, they get fewer and fewer. And so just like we don't want to be at the grocery store the night before school starts getting pencils and erasers, we don't want to be trying to scramble to get our school physicals done. So I would call today.
Rounding out our episode, here's question number 4.
Dr. Straight, if I get vaccinated, can I still get the flu?
That's a great question. There was a study done a couple years ago. They studied 1,000 people, and of those 1,000 people, 43% thought they could actually get the flu from the flu vaccine, which is not possible. Because it is a big myth regarding the flu vaccine, specifically the shot. So if I saw a truck on the road, I might say that's a black truck, but then when I got closer to it, it may not have any wheels or an engine or a transmission, and the truck's not going to go anywhere. Similarly, this flu vaccine just has the parts that your body needs to make an immune response against the virus. Also, every year flu changes. It's constantly changing, and every year experts get together and decide what's going to be in the flu vaccine this year. And some years they get it better than others. But the idea is that you're much less ill than you would have been if you didn't get the shot. Very important for the elderly who have other chronic conditions. Getting sick from the flu after having the shot may be very minimal. If you don't get the shot, getting sick from the flu can be very serious. In fact, risk of heart attack goes up, risk of hospitalization goes up, risk of death goes up. And if I hadn't mentioned already, there's about 40,000 deaths every year in the United States due to influenza.
As we finish up this episode of Straight Talk, I always want to remind everyone that what you don't know can hurt you.
All right, that's all the time we have. Thanks for joining us. We'll see you next time on Straight Talk.